This is a quick video describing terms of direction in anatomy. Anatomists use very specific language to describe the relationships of structures to each other in 3D space. We're going to use those terms too. The terms of direction come in pairs. Let's start with anterior, which means in front of, and posterior, which means behind. For example, the eyes are anterior to, in front of, the brain. And in the chest, the heart is posterior to, in back of, the sternum. Next we have superior, which means above, and inferior, which means below. Now, I know what you're thinking. Kingston, seriously? Superior and inferior? These terms seem kind of loaded. I know, and I'm not disagreeing. But the fact is, these terms are literally thousands of years old. They are entrenched in anatomy, and we are stuck with them. For example, when we study the heart, you're going to find two large veins draining into the right atrium. The proud superior vena cava above drains the top half of the body. Poor little inferior vena cava down low drains the bottom half of the body. Next, we'll consider left and right. Those terms need no explanation, but there are related terms that you may not have encountered before: medial and lateral. These terms describe a structure's location with respect to the midline of the body. Medial means toward the midline. Lateral means to the side, away from the midline. There is another term, median, that means at the midline, like dead center. For an example, let's consider the clavicle, our most commonly broken bone. We can palpate its medial end here, toward the midline. Then, feeling our way along the length of the clavicle, we can locate its lateral end out to the side, away from the midline. Next, we'll consider superficial, which means toward the surface, and deep, which means away from the surface. For an example here, let's consider the rib cage protecting vital internal organs like the lungs. If you consider my right lung, and then ask the question, is the right side of the rib cage anterior to, or lateral to, or posterior to the right lung? The answer is yes, all three. In front, the ribs are anterior to the lung. Out to the sides, the ribs are lateral to the lung. And in back, the ribs are posterior to the lung. Now here's a simple statement that you can make that's true in all cases, regardless of the observer's perspective. The ribs are superficial to the lung. The lung is deep to the ribs. Next, we'll consider dorsal and ventral. Dorsal means backside. Think of a shark's dorsal fin. And ventral means belly side. These terms also refer to the locations of structures in the human nervous system, which gets complicated in a way that I'll explain in a little bit. Finally, let's consider rostral and caudal. Rostral means toward the nose, and caudal means tailward. Again, these terms also refer to structures in the human nervous system, which gets complicated. The complication arises from the fact that humans have a 90-degree bend in their neuraxis. This is unusual and very different from most of our vertebrate cousins. The situation is simpler in a quadruped, so we'll consider that first. Consider a dog or a cat. Rostral, toward the nose, is always anterior. Caudal, toward the tail, is always posterior. Dorsal or backside is always superior. And ventral or belly side is always inferior. These orientations never change. In humans, the situation is similar at the front of the brain to a quadruped, but because we decided to stand upright, structures at the bottom of the brain and the entire spinal cord, they're dangling down and everything rotates 90 degrees. So in the brainstem and spinal cord, rostral structures are above or superior to caudal structures, which are inferior, and dorsal structures are posterior to ventral structures. A bit of a complication, but it's not too much trouble outside of the nervous system. There's one more set of terms that I didn't list: proximal versus distal. Proximal, like proximity, means closer to a point of reference, and distal, like distance, means farther away from a point of reference. There's a bit of a complication, though, in that the point of reference can be a fixed anatomic spot, like the attached base of a limb, where, with reference to that base, things can be proximal, close to it, or distal, far away from it. But then the terms can also be used in situations referring to flow, like the flow of blood from proximal to distal. So that gets a little complicated. And that's it. We've covered all the terms of direction. We're done.